Please mute yourself.
Yeah, fine.
Okay. So basics of AST is very important. As I was telling, it's a learning thing for postgraduates. And whenever there is a problem with whenever you want to do troubleshooting, when you don't have correct results in your whenever you do the clinical reporting, or whenever there's no reproducibility, or whenever you put weekly QC, the QC does not pass, then you have to go back and look into the basics as of why this is happening. For all that, basics of AST is very important. So Pallab sir has covered everything. I'm just going to tell in detail, and this is going to be a repetition also. Okay, so sir has already told us why we use Muller-Hinton Agar. It's very important to understand, as sir has enlisted all these reasons. One is it shows batch to batch reproducibility for AST. It's low in inhibitors. So if there are inhibitors, it affects the results or reading of more commonly, that is cotrimoxazole, trimethoprim, sulfonamide. It affects the result, and also tetracycline. So it's very important to take care of this, and it supports the growth of most of the pathogenic organisms. That is why MHA is chosen. It has a very good, the reproducibility of results are very good, and it is being used from ages, and it has been also tested for many in many agencies that it works very well. So Muller-Hinton Agar is the most commonly used media for distribution. Yeah, and these are the reasons why we choose Muller-Hinton Agar. So now when we talk about, as sir has told, there are various aspects you should remember in how do we go about storing the AST plates. Say suppose we are using in-house media, sir has told that within 7 days you're supposed to use the media. Like that, before use, what are the points you should consider? Most important is drying of technical team. Please mute the people who are creating the background noise. Yeah, so drying of AST plates is very, very important, because if there are water droplets or if there are moisture which is present on the AST plate when we are going to do the lawn culture, then it will lead to more of a fuzzy zone when we take the reading the next day. So you should make sure that your plate is completely dried. There should be no water droplets on the surface of Muller-Hinton Agar. It does not mean that the last point is also important, because what will happen is, most of the time what our technicians do, the minute we tell the plate has to be dry, they leave the Muller-Hinton Agar plate for 1 or 2 hours at 37 degrees Celsius. This will remove the moisture in the medium. That also should not be done. Ideally, at 37 degrees Celsius, around 15 to 20 minutes is more than enough to dry the plates adequately. Okay, a larger plate, that is 90 plates, require around 15 to 20 minutes. If it is a 150 plate, it requires around 40 to 50 minutes. Okay, so this has to be kept in mind, and it should not be over dried also. Next important component is how do we store the AST plates. So storage is at 4 to 8 degrees Celsius. Okay, if it is an in-house prepared media, there should be a lab protocol which tells us how do we go about storing and what is the shelf life of the media. If it is a commercially prepared media, again, it depends upon the manufacturer. And if we have a practice of procuring the commercially available Muller-Hinton plates which are sealed, those plates tend to have more moisture than the usual, because it is the water of condensation will be there. So you should explain them that adequate drying of plates is must before they do the lawn culture. Okay, these are the points to be noted when we are using Muller-Hinton plate, especially before use. So technical team, please display the answer for this polling, the 4 questions.
Yeah, please display the answer. Please display the answer. Anybody is there? Where are they? From technical side, Neeraj?
Yes, sir.
Yeah, please respond, no?
Yeah, I was making the co-host.
No, this is not poll 2. You have to display answer
Why
of
are you
poll 1.
displaying all 2 questions now?
Yeah.
Rishabh, The poll one answers we have to show.
Yeah. Okay, so these are the results. So we will discuss all these questions individually and we will see what is the right answer. Okay, so most of you have gone to, yeah, option 3, majority of you, and majority of you have answered. So we'll read the question again. That is, excess of thymidine and thymine in Muller-Hinton agar on AST leads to all except. So when we talk about Muller-Hinton agar, contents of Muller-Hinton agar, there are various aspects which are very important. That is making sure the pH is correct, making sure your thymine and thymidine concentration is adequate, and also your cation concentration. Okay, all these three are very, very important to note. pH is where pH should be checked whenever we prepare the media. Every batch of media we have to check the pH, and thymine, thymidine and cation concentration goes with the every batch of Muller-Hinton agar we use. So this has to be kept in mind. So in this question, what is the question? In the MHA Muller-Hinton agar, what you have got, there is, say suppose there is excess thymine and thymidine. How will you, what will be the results? So the answer here, it leads to more false resistant results. All other options are correct. That is, they reverse the inhibitory effect of sulfonamide. Okay, and sir Pallab sir has already explained that because they provide alternate pathway for folate metabolism. Thymine, thymidine provides an alternate pathway. That is why it leads to false resistant results. And how do we make sure that thymine, thymidine concentration is adequate in our Muller-Hinton agar? Is you put a quality control every time you prepare a Muller-Hinton agar. Inoculate E. faecalis 80 cc strain, okay, 29212 strain, and look, and you put up cotrimoxazole disc. If your cotrimoxazole disc is more than 20 mm, then it tells that your thymine, thymidine concentration in the Muller-Hinton agar is adequate. Say suppose if it is less than or equal to 20 mm, you repeat the test again, it is same, then you have to exchange that batch of media with the manufacturer or with the dealer. You have to exchange. Okay, so this is please note that every time a Muller-Hinton agar is prepared, one is you check pH every time. If you're doing it daily preparation, you have to check it daily, and also look for adequate thymine and thymidine content. Okay, now there is a table which I'm going to show you little later, which summarizes all the important aspects. So this we have already seen, that is thymine and thymidine reverse the inhibitory effect of sulfonamide and trimethoprim by providing alternate pathway for folate metabolism. So this leads to smaller zone or false resistant results. So in the option, it was false susceptible result. Say suppose you in your day-to-day practice also, if your results are not consistent, you can always go and look back to all these aspects. So this QC part I have already explained. That is, you inoculate 80 cc faecalis 29212 and put up a cotrimoxazole disc. If it is more than 20 mm, then that is a QC for your thymine, thymidine content in your Muller-Hinton agar. Okay, so next please, this option also, this question also all of you have seen. Now we have to understand other components, that is cation concentration, role of cation concentration in Muller-Hinton agar. So whenever there is excess calcium in your Muller-Hinton agar, it leads to reduced zone size of aminoglycoside, tetracycline and daptomycin, and not carbapenem. Okay, so all this is not like you have to remember all this, but it is important for you to have this chart. This chart is summarized by Apoop sir. It is so nicely made that this chart can be put in your media room, and you have to educate your technicians regarding this. So let us understand this table. Okay, I think almost 3 or 4 pages of M02 document has been summarized in this table, very easy to understand. So what is given here is this is all cations. Okay, so there is upward arrow means that if the concentration of calcium increases, downward arrow means that if the concentration of calcium decreases. Same holds good for magnesium. When the concentration increases, decreases. Zinc increases, zinc decreases. Means if this concentration increases, what will happen to your susceptibility results? And next is, if the pH increases, pH decreases, what is the role? And if your thymidine concentration increases. So first let us see about calcium. Okay, if the calcium concentration increases, then what will happen? You will get all this other findings, that is you'll get resistant, false resistant report for aminoglycoside, tetracycline, and you'll have more false susceptible report for daptomycin. Okay, so all these are the occurrence. Then if your calcium concentration decreases, then you will get false susceptible result for aminoglycoside, tetracycline, and false resistant result for daptomycin. So this is the result. So all of you can make this table. So it's very self-explanatory. You can put this table and refer to this for doing the, while you're preparing the Muller-Hinton agar. Okay, same holds good for magnesium also. If the magnesium concentration is very high in the medium, these are the consequences, and if magnesium concentration is low, then it is vice versa. What is the role of zinc? So if there is zinc excess or reduce, it will mainly affect our cotrimoxazole disc. So if the zinc concentration is high, false resistant results, and zinc concentration is low, you'll get false susceptible results. If the pH is
Can you show the previous slide? Some of them are asking.
this one, sir.
Yeah, I mean they probably want to compare the answer.
Yes, sir.
Can you press on E, Deepashree? Erase.
Okay, sir. Yeah.
Yeah. Yeah. Now you go ahead to the presentation. Now you continue with your presentation.
Yes, sir. Okay, so we were understanding the role of pH. So if the pH is altered, it affects aminoglycoside, tetracycline, then it affects quinolones, clindamycin, and macrolides also. If the same thing holds good if the pH is low. So these are the drugs which gets affected. When thymidine concentration is low, it is cotrimoxazole which gets, thymine concentration is high, the cotrimoxazole results will get altered. Okay, so this is a table, very important table to tell what is the role of cation concentration, what is the role of pH and thymidine concentration in Muller-Hinton agar. Okay, so this has to be kept in mind. So this we have already seen. So 29212 cotrimoxazole disc. This is for adjusting the thymidine concentration. Okay. Next, coming to preparation of inoculum. As sir has already given an introduction, there are various small steps which become so crucial, which these smaller steps which not done properly will affect the distribution results. So the most important, we are going to discuss, I'm just showing a overview now, then individually we will discuss the important aspect. The first important component is picking up right type of colonies. So it is very important to pick up, especially when you have a mixed growth, it is important to pick up morphologically similar colonies and not otherwise. Okay, and it has to be picked up from a non-selective medium. Next is inoculum preparation. Lawn culture is very important, and then the inoculating the disc on the Muller-Hinton agar. Now coming to preparation of inoculum, sterile loop or a cotton swab is most commonly used to pick up the colonies. It is picked up from an overnight culture on a preferably non-selective media, and as I told you, morphologically similar colonies has to be picked up to avoid selecting a mixed growth, because that is going to impact your distribution results. And we usually suspend the colonies in saline and mix to an even turbidity. So this is a question which was asked regarding the colony suspension, about the inoculum preparation. We all know there are two methods. One is growth method, other one is colony suspension method. Colony suspension method is a most commonly used method. So colony suspension method of inoculum preparation, all are true except. So it is usually preferred over broth culture method. Yes, because it's quicker. It is must for testing fastidious organism. Yes, because with growth method it takes a longer time. Also must for testing cefoxitin and staph aureus. Yes, it can be used when fresh colonies are not available. No, this should be, if fresh colonies are not available, it is better to go with the growth method of inoculum preparation rather than going with the colony suspension. Okay.
So 45% have answered correctly.
Yes, sir. Okay.
Go ahead.
Yes, sir. Okay, so this is a list where colony suspension method is important and broth culture. So colony suspension, most convenient method, must for fastidious organism, as we have already seen in MCQ, that is Haemophilus, Neisseria, Streptococci and others. Also must for cefoxitin, staph aureus, and when fresh colony is there. Or broth culture method is an alternate method for non-fastidious organism, exception we have already seen, and fresh colonies are not available. It is preferable that you do growth method. Okay, so these are the points. So how do we go about colony suspension method? 3 to 5 morphologically similar colony with 18 to 24 hours of incubation, not older, from a non-selective medium is taken. Make a direct broth or saline suspension from isolated colony, adjust it to 0.5 mcFarlands with broth or saline. Okay, this is how we do the colony suspension method. Broth culture method, again morphologically similar colonies are taken. They are inoculated into suitable medium. Sometimes we use peptone water, we use BHI broth or tryptic soy broth. They are incubated for 2 to 6 hours, okay, until you reach the 0.5 mcFarland, and then turbidity is adjusted with the help of broth or saline. These are the commonly used method for performing the method for inoculum preparation. Next, coming to turbidity adjustment, another crucial aspect. So, can I get an opinion of how many of you are really using 0.5 mcFarlands in-house or commercially procured? Anyone please unmute and answer. I think whoever is in the panelist group, please unmute and interact so that it will become more interesting.
Yes, ma'am. With the automation, we are using McFarland, but for manual method, no.
For white tech, no, madam?
Yeah.
Yeah, okay. Any other inputs? Anyone finds it very difficult or not reliable with 0.5 mcFarlands? Any PGs are there? Yeah. Your voice is not audible, sir. Someone who's trying to speak, your voice is not audible. Any other inputs? Postgraduates, can you just tell, because there are so many, I think more than 50-60% are postgraduates. Can you just unmute and tell what is the importance of turbidity adjustment? Any PGs, please? No one is volunteering, huh? Okay, so it's advisable that you'll interact. This is a workshop, not a CME or a conference lecture, please.
I think
Okay.
Dr. Sagar wants to speak.
Yes, sir. So how to give them permission to on their speaker?
They can on their speaker by themselves.
Dr. Sagar, huh?
No, now he's not interested.
Okay. So McFarland standard, sir?
Okay, he's not a panelist. He can't speak.
Okay, sir. Yeah. So McFarland standard is usually prepared according to the SOP using barium sulfate, or even latex particle is available. This use of latex particle will help in increasing shelf life and also stability of the McFarland solution. So most commonly for all bacteriological cultures, we use 0.5 McFarlands. How do we equate that to 1.5 into 10 power 8 CFU? Okay, so it is important that whoever is using a photometric device for adjusting the 0.5 McFarland, there are two important things. One is it has to be calibrated, and there's an option mostly that glass or plastic. Most of them may not be aware of this only, and they use it use it improperly, which will give erratic results. Okay, you have to choose depending upon what test tube you are, because for Vitek when we use plastic, whereas mostly other routine culture we use glass. So this has to be chosen correctly, and the calibration has to be done as per manufacturer instruction. Say suppose you are preparing in-house McFarlane's, then every 6 months you should subject that solution for spectrophotometry to make sure that it is 0.5 McFarlane. Okay, so visual inspection method is also available, that I will show the picture. So this is a picture of photometric device.
You can erase the content.
Yes, sir. So this is a picture of a card, the white card with this is called as, one second, I'm not able to change the slide. Yeah.
Vikiranam chart, yeah.
Yes, sir. One second. So there are two methods. One is using a photometric device. Second one is a white card with the black lines. So this card is used, which is called as Wickerman card, which is used for adjusting the optical, adjusting the 0.5 McFarlane. This is another method where you should keep it at a distance of 0.5 to 1 centimeter. The test tube should be kept at a distance of 0.5 to 1 centimeter, and you have to match. You should be able to clearly see all the lines. Okay, edges of the line should be clearly visible, and this is called as Wickerham card. So this question also all of you have answered. There is a 15-15-15 rule with respect to disk diffusion test. So what is this rule? So the first option is lawn culture is done within 15 minutes after turbidity adjustment. So this is a correct option. Zone diameter measurement within 15 minutes after the plates are taken from the incubator. Is it correct? There is no rule like this. The other for part of the 15, first is after the turbidity is matched, you have to do lawn culture within 15 minutes. After the lawn culture within 15 minutes, the plates the discs has to be placed, and after placing the disc within 15 minutes it has to be placed in the incubator. Okay, one is you have to do lawn culture within 15 minutes of matching the turbidity. Second is after you do the lawn culture within 15 minutes you have to place the disc, and within 15 minutes of placing the disc the plates has to go into incubator. Okay, this is 15-15 rule. So swabs are, this sir has already explained. So it is dipped in broth, rotated and pressed several times to remove the excess fluid. So it is pressed several times to remove excess fluid, and you have to turn the plate 60 degrees for 3 times, and then you have to do the lawn culture. Press the disc. Whenever you place an antimicrobial disc with your sterile forceps, you press it to ensure the contact of the disc with the surface of the agar. Invert plates incubate for incubated 37 degrees or 35 plus or minus 2 degrees, except for MRSA it is 35, non-CO2 environment. So there are exceptions, but mostly antimicrobial AST plate should not be incubated in CO2 incubator. And whenever you're incubating, another important point is you have to not keep more than 5 plates. Usually what we do, we stack the MHA plates and we keep it in the incubator to ensure the proper heating around the plates. So it is ensured do not pile up more than 5 plates when you're keeping the anti-AST plates inside the incubator. Okay, so this is a 15-15 rule. Again, I'm repeating. So lawn culture within 15 minutes after turbidity match, place the disc 15 minutes after lawn culture, incubate 15 minutes after the disc, within 15 minutes after the discs are placed. Okay, these are the important points with regard to application of the disc. So next, coming to another important component, that is storage of disc, which is very crucial, because if the disc potency is lost, then there is no point in performing antimicrobial susceptibility test. So from the time of you procuring the disc till it is being used, it is very crucial to monitor and follow correct guidelines. So for most of the antibiotic, crucial for especially for beta lactams, it is stored in freezer, that is less than 14 degrees Celsius, and the working discs are refrigerated. The stock what you get, you store it in the freezer, and only working disk you can keep it in the refrigerator, which you're going to use daily, can be kept. And once the working disk stock is finished, you can bring it from the freezer to the refrigerator. Okay, in the refrigerator it should be stored for a maximum of 1 week. Okay, these are the points. For there are certain labile discs, especially clavulanic combination disc, cefaclor, imipenem, are unstable at even in the refrigerator, that is at 2 to 8 degrees Celsius. So for these discs, it is advisable that till the day of use, you can keep it in your freezer. That is, if -20 is available, -20, and maybe a little earlier. Usually we tell 20 to 30 minutes before you place the disc on the MHA plate, bring it to the room temperature. If it is frozen, you can take the disc out little earlier and let it come to the room temperature. So remove working disc with dispenser 1 to 2 hours before the use to equilibrate to room temperature. Minimize the amount of the equilibration to room temperature is needed to reduce the amount of condensation water droplets which will form on the antimicrobial susceptibility disc. Once opened, cartridge should be stored in a tightly sealed desiccated container. There are silica gels which are available, which are hygroscopic, which absorb water, so that can be kept in the pack of antimicrobial disc. And disc dispenser also should be stored in a tight container and refrigerator, because we would have put a vials of antimicrobial disc. If the desiccant, if you have a habit of using the desiccant, that is silica gel, if you have to look for the indicator. If there is change in the color, means it has lost the ability to absorb the moisture, it has to be replaced. Okay, so these are the important points. I repeat again, if you get a stock from the manufacturer antimicrobial disc, it has to be kept in -20. Only the working stock of antimicrobial disc will be kept in 2 to 8. Okay, so there are few drugs most commonly used, that is imipenem, clavulanate combination drugs, and cefaclor should be frozen till the day of use. So these are the key features in the slide. Okay, if the discs are expired, it has to be discarded. It should not be used for clinical reporting. So next, coming to another question. So technical team, please display the poll for the second part of the questions. Technical team, anyone is there? Yeah.
Yes,
All
ma'am.
of you please answer these
Can
questions.
now.
Yeah. So please answer this question. So second half of my presentation, these are the questions. If you answer one by one, we can see the answers with the explanation.
Neeraj, the panelist also can answer, no? The participants who are panelists?
Yes, sir.
Analysis can answer.
Only host and co-host cannot answer, is it?
Yes. 1 minute left. $30 left. Time's up. Time's up.
How many have answered so far?
118 people voted.
Okay. Deepashree, I mean, the first question can be discussed here itself.
Okay, sir. Yeah.
So you saw the answer here.
Okay, sir.
Neeraj, you displayed the answer also?
The results, sir?
Yeah. The result.
Okay, I can show the result.
Yeah, because the first question, yeah. So 50% have answered correctly.
Yeah, I've answered answered it correctly. So this question I'll just read again quickly. According to CLSI guidelines, all the following are true. For disk diffusion, maximum 12 disk in a 150 mm plate and 6 disk in a 100 mm plate. This is a correct response. Measure the diameter of zone of complete inhibition as judged by the unaided eye, including the diameter of the disc. This is how we measure the zone diameter. Hold a Petri plate a few inches apart above a black illuminated background with appropriate light. So this is correct. Only thing is distance between two discs should be 24 mm. So let us see the important points here. This we have seen 12 disc in a 150 mm plate and 6 disc in a 100 mm plate is what is recommended. First, streptococcus with 5% blood with Muller-Hinton agar when you're using, because usually the zone size are larger. That is why lesser number of discs are recommended. That is, in a 150 mm plate, 9 discs should be put and 4 discs in a 100 mm plate. Otherwise, in non-fastidious, you put 6, whereas 4 in, because 4 in fastidious organism, because the zone size are usually larger. So this should be placed no less than 24 mm apart, center to center. Whenever you're taking reading of the AST plate, it has to be placed with the black background illuminated with the reflected light. This is not for all situations. There are situations where even transmitted light is recommended, which we are going to see. So second question was, full 24 hours incubation of disk diffusion test is mandatory before interpretation of all the following except. So what is the answer here? Cefoxitin disk diffusion for Staph aureus, Vancomycin screen agar for Vancomycin MIC for Staph aureus entero, Vancomycin disk diffusion for enterococcus, and oxacillin MIC for Staph aureus. Here it is except. That is, there are situations where 24 hours incubation is mandatory, but this is not for Staph aureus. In cons, 24 hours incubation is mandatory, not for Staph aureus. For your Vanco screen agar and Vanco MIC for both Staph aureus and entero, 24 hours is mandatory, and oxacillin MIC for Staph aureus also 24 hours is mandatory. So this is the usual, whenever you open a CLSI page, any page, this is a most commonly seen numbers. That is, for disk diffusion, it is 16 to 18 hours. And for dilution, whenever you determine MIC, it is 16 to 24 hours. There are a few situations where full 24-hour incubation is mandatory. As I told you, cefoxitin disk diffusion for cons, not for Staph aureus. Whenever you use vancomycin in Staph aureus and entero, oxacillin MIC for Staph aureus, mupirocin for Staph aureus, high-level gentamicin bar streptomycin, either agar or broth dilution. And in cystic fibrosis patient, whenever you isolate Pseudomonas aeruginosa, it has to be kept for full 24 hours. So how do we go about routinely reporting at 16 to 18 hours? If it is resistant, you can report, whereas if it is sensitive, you have to cross-check once more at 24 hours. Okay. So there are other situations where there are places where they have mentioned 20 to 24 hours in CLSI, Acinetobacter, Burkholderia, Stenotrophomonas, and certain fastidious organisms like Strepto, Pneumococci, Neisseria, and Haemophilus. The 20 to 24-hour incubation is recommended. Okay. Now coming to, whenever after your incubation, when you take out the plates for reading the AST, it is very, very important to see whether there is uniform growth. Okay. It is must for all the technicians or whoever is doing the bench work to get trained adequately to produce uniform growth in the lawn culture. If there are isolated colonies, you have to repeat the test, which will cause your turnaround time. It will delay and the patient will suffer. So it is very important for the trained technician to perform AST. Okay, you can see the picture here. You can see it is uniform growth is seen, including the blood agar with MHA. you can see uniform growth. I'll show you the second picture. You can see here there are isolated colonies. These are termed as not satisfactory. And EUCAST, this is a picture from EUCAST. It is clearly told that if it is not satisfactory, you have to repeat your AST, because all the AST breakpoints are standardized considering this. It is not standardized for this. If you interpret the clinical breakpoints for these type of cultures, then it may not reflect correctly. Sometimes a sense, because wherever intermediate zones are not available, it can vary grossly in terms of very major error, that its sensitive can be resistant can be reported as sensitive. Very major error can occur. So it is very important for your lawn culture should have uniform growth and not isolated colonies. So now let us see, there are various points to be noted. How do we measure the zone size? This picture will tell you exactly how to measure zone size. So sir has clearly told that AST is for growth and nothing other than growth. That you should remember. It's a very nice sentence Pallab sir has just told. You just have to remember edge of the growth. If there is swarming, if there is hemolysis, all that should be ignored. Let us see few pictures one by one. So this picture tells you that whenever you're taking the reading, you can see there are few fuzzy edges there. So all that should be ignored, and only the clear margin should be considered for reading the zone diameter. This is for E. coli ciprofloxacin, Staph aureus erythro. Also you can see there is such a wide zone where it is fuzzy margin. And here cons trimethoprim, also you can see there is the edges are not very sharp, so you should take the innermost edge where the zone diameter is clearly visible. Okay, so now coming there are important points whenever you are recording the zone diameter. All of you, it is important to try and use vernier calipers when you're measuring zone diameter. Okay, visual inspection, most of them do not, do like that, but it is wrong. You have to measure and record the zone diameter in your culture register. It is very, very important. Rather than the traditional scale, we use verniers calipers are more accurate in measuring, because we as we see the breakpoint table, we can see every millimeter has to be measured. It is if there is a small difference, then it will turn into sensitive into resistant and vice versa. So that has to be seen clearly. If there is double zone, especially for postgraduates who are now learning how to measure zone diameter, it is important for you to, if there is a double zone, first thing you need to confirm whether it is the same colony of interest. If it is, for that, what you do gram stain, and you also look at the colony morphology on the MHA plate and see whether their gram stain is a must if there is if there is double zone. Okay, confirm whether it is the same colony. If it is not the same colony, repeat the test. Okay, if it is pure, then again you go and take the innermost zone as your zone margin for measuring the zone diameter. So you can see in the first picture there are few isolated colonies or at the edge. So again, if it is too much isolated, you have to go and repeat the AST. Otherwise, if it is the same type of growth, you can interpret the edge of the zone. Okay, edge of the zone. So all these four picture will again tell you that first you choose the innermost edge of a zone to measure the zone innermost margin to measure the zone diameter. Okay, this is how you do whenever there is double zone. If there is a fuzzy zone, again hold the place. So how do you measure? It is very difficult to measure whenever there is a fuzzy zone. So the recommendation is use a dark background, keep this plate around 30 centimeter far, and estimate where the zone is. Again, it is naked eye estimation, not by use of magnifying glasses. Just estimate and look for the zone margin clearly and measure the zone size. Okay, same principle holds good for even staphylococci. These are the in enterobacterials, few drugs tend to give this fuzzy zone, and even in staphylococci we see many a times erythromycin giving the fuzzy zone. So you have to determine the clear margin. Now, whenever we read the MHA with 5% blood, the blood MHA agar, it is very important to distinguish where is the margin of hemolysis and where is the margin of growth. Again, you have to take margin of growth and not the margin of hemolysis. You can see in this picture that margin of growth and margin of hemolysis is different. So here is a margin of hemolysis, whereas here is a margin of growth. So it is must that you take margin of growth and not hemolysis. So this has to be done. So the sentence given in EUCAST is tilt the plate back and forth to better differentiate between hemolysis and growth. And beta hemolysis is usually free from growth. Free from growth, you just take the edge of the growth. Same thing holds good for alpha hemolysis also. So another question which was posted is again regarding the light. So either reflected light or transmitted light, which one do we use? So which of the following distribution AST reading is taken in reflected light? So cefoxitin, Staph aureus. So let us see the list now. AST reading in transmitted light, not the reflected light. As sir told, there are some organisms which grow slowly. Because of the drug bug combination, the growth may not be appreciated in the reflected light. That is why there are very few situations where transmitted light is used. That is linezolid Staph aureus, penicillin zone H test, mupirocin Staph aureus, vancomycin screenagar Staph aureus, and vancomycin enterococcus. These are the condition or situation, drug bug combinations where transmitted light is used, not reflected light. Another question what was posted was, according to CLSI guideline, all the following regarding AST are true except. So the zone margin should be considered as area with no obvious visible growth detected with an unaided eye. Do not ignore the faint growth, the tiny colony that can be detected with magnifying glasses. Next is about the swarming. Last is about the cotrimmoxazole disc. So as we have already seen, magnifying lens, use of magnifying lens is not recommended whenever it is recommended in very few situations, that is oxacillin and vancomycin in staph and entero. Other than that, it is not recommended to use a magnifying glasses. So we'll see the picture one by one. As we have already seen, measure the obvious growth, ignore the faint or tiny colonies which are seen in magnifying lens, because use of magnifying lens is not recommended only. If there is a visible colony seen, confirm whether it is the same organism. If it is the same organism, measure the inner free colony free zone. So this is a picture which is given in EUCAST, very clear picture. In with respect to cotrimmoxazole, in enterobacteriales, Acinetobacter, Burkholderia, Stenotrophomonas, staph, pneumococci, Haemophilus, and Neisseria. That is, in this drug bug combination for all this organism, whenever you are measuring cotrimmoxazole, there is a rim of that is, there is a place where you see less than 20% of the lawn growth near the margin. So it is told that you can ignore this part of the margin only in this situation. This is not a generalized rule. Only in this drug bug combination, you can ignore this zone. That is, whenever there is a slight swarm of 20% of the less than 20% of the lawn growth, you can ignore and take the more obvious margin. So these pictures will tell you that A to C, an outer zone can be seen. Report susceptible if the zone diameter is more than 16 mm. And growth up to the disc or no sign of inhibition, only this you will report as resistant. Remaining all, if there is adequate, your breakpoint is satisfied, then you report it as susceptible. Next is same with Proteus swarming. Ignore the swarming. Okay. Only consider here swarming is seen in this part. So you just take the more obvious margin. Same, another important scenario is Fosfomycin and E. coli. In this combination, mostly you see isolated colonies within inhibition zone. This is a very most commonly done seen situation. They have done a lot of study, and EUCAST has published a paper also on this. It is told that first do a gram stain, confirm it is same organism. If it is same organism, you can ignore isolated colonies. Again, this is specific for this drug bug combination. Especially postgraduates, do not think this is a general formula. This is only for Fosfomycin E. coli. So you can see here in A, B, and C, you can ignore all the inside colonies, and only in D you can report it as no zone, because there is no clear space between the isolated colonies at all. That is why you report it as no zone. Next, vancomycin distribution for enterococci. Again, very important. Most of us may not be familiar with this. I will read the sentence first. Sharp zone edge and zone diameter of more than 12. This is EUCAST breakpoint. Same thing will be applicable for CLSI breakpoint. Report as susceptible. That is, If there is sharp zone, then you report it as susceptible. If fuzzy zone edge or colonies within the zone, then it is required for you to perform another test and then confirm the vancomycin susceptibility to susceptibility in enterococci. Okay, this is a very important thing. Sharp zone is there, then your breakpoint is satisfied, then you can go and report it as sensitive. If it is fuzzy zone, it is always better to have a backup confirmatory test. All of us must be aware with this. This is penicillin disc zone edge test, which is nicely described in CLSI. There is a beach and cliff effect. If it is beach effect, it is sensitive. Cliff effect, if it is resistant. Cliff is nothing but a sharp zone. If it is a beach or a very fuzzy zone, it is sensitive. Here it is other way around than what we saw. This is for penicillin zone edge test. Okay. So this is my presentation. Next, Apurva sir will start with general terminologies. If there is any doubt, we can discuss it now, or we can discuss it after all the sessions. Anything is there specific we can discuss now? Otherwise, this questions we can take it up at the end of the today's program. Because there are so many aspects each of us are covering, all of you should listen to